Do you frequently feel like you're coughing more than usual, even for weeks? Or maybe you feel tired all the time, lose weight without trying, or get night sweats like you just ran a marathon while sleeping. These might not just be flu symptoms. They could be signs that something more serious is going on, like tuberculosis or TB. TB mainly affects the lungs, but it can also hurt other parts of the body. It's not just an old-time disease, it still affects millions globally. Have you ever been around someone who kept coughing for months? Maybe you were curious if it was contagious. Yes, TB can spread through the air when someone with active lung TB coughs or sneezes. But don't panic, not everyone with TB is contagious, and it's treatable. So what causes TB? It's caused by tiny bacteria called Mycobacterium tuberculosis. Think of them like invisible tiny bugs, much smaller than dust. You can't see them, but they can live in your body. Most of the time, these bacteria go sleeping in your lungs. This is called latent TB. You feel fine, have no symptoms, and can't spread it to others. But if your immune system gets weak, maybe from stress, diabetes, or other sicknesses, the bacteria can wake up and cause active TB. Imagine you have a strong security guard, your immune system. As long as it's strong, the bad guys stay locked in a room. But if the guard gets tired, the bad guys break out and start causing trouble. That's what happens in your body. Now, how do you know if you might have active TB? Ask yourself, have you been coughing nonstop for more than 2 weeks? Is your cough sometimes bringing up blood? That's a big red flag. Do you feel weak no matter how much you rest? Are you losing weight even though you're eating normally? Or do you have chills and fever, especially at night? These are classic signs. Imagine your friend Ali. He went from playing football daily to lying in bed, coughing all night and losing 10 kilos. His family thought it was stress, but it was TB. Not everyone gets all symptoms, but long-term cough and weight loss are major clues. Again, if you know someone like Ali, gently suggest they see a doctor. It could save their life. How do doctors find out if someone has TB? First, they ask about symptoms and history. Then, they might do a skin test like Mantoux or a blood test. These check if your body has ever seen TB bacteria. If positive, they check your lungs. A chest X-ray can show if there's a shadow or damage. Then, they test your sputum, a mix of saliva and mucus you cough up. They look for the bacteria under a microscope or use a fast test like Gene Expert. If TB is found, the good news is it's treatable. Patients take antibiotics every day for at least 6 months. Yes, it's long, like watching a favorite series that goes on for seasons. But skipping doses can make TB harder to treat. So doctors often use DOTS, directly observed treatment, where a health worker watches you take medicine. This ensures you stay on track and get better. Can TB be stopped before it starts? Yes, one big way is the BCG vaccine. Many babies get it at birth in countries where TB is common. It doesn't fully prevent TB in adults, but helps protect kids from severe forms. Also, good habits help. Avoid close contact with someone who has active TB, cover your mouth when coughing, and improve ventilation at home and work. Sunshine and fresh air. Yes, they kill TB bacteria. Imagine opening your room's window daily like a morning ritual. Simple, but powerful. And if you test positive for latent TB, your doctor might give you medicine for a few months to stop it from becoming active. It's like fixing a small leak before it floods your house. Scientists are working hard to make TB care better. One big advance is the Gene Expert machine. It can detect TB and check for drug resistance in just 2 hours. No more waiting weeks. Newer drugs like bedaquiline and pretomanid are helping treat drug-resistant TB, which was once nearly impossible. Also, there are experimental vaccines being tested. Imagine a future where one vaccine fully stops TB. Exciting, right? Also, phone apps now help patients remember their meds, and AI helps doctors read X-rays faster. These small tech steps are making a big difference in villages and cities alike.